Hello everyone, I'm Dr. Om J. Lakhani and I'm here demonstrating the product which you developed, which is called diabetology.co.in. Now, this product is basically a diabetes co-pilot for physicians, so it helps physicians to manage their patients with diabetes in a comprehensive way. It also uses precision medicine and personalized medicine. Everything is evidence-based and everything is then codified. So this is the entire product. Now, this can be integrated into the existing EMR of the physician, but it is also available as a standalone application. So right now what I'm going to show you is a demonstration of the product. It's not the complete product as yet, just a demonstration to show you the features of this product and what we are developing. So the flow of this product is as follows. So you have a patient with type 2 diabetes. You input the patient variables. The various variables which you are going to input is going to be shown here. Then you go through the precision engine. So we use the input variable to create a precision through the precision engine to develop a precision medicine algorithm. We also give you deep clinical insights based on the data which you have provided. Then we add a personalization filter. So based on the patient's preferences and the doctor's preferences, you can have a personalization filter. And then finally, it will give you a treatment plan with rationale and evidence for the same. And finally, a suggested prescription for the doctor, which the doctor can then copy it or he can print it and give it to the patient, right? So let's start, see how it works. So here, this is the first page where you enter the patient's initial patient data, the initials of the patient, the age of the patient, the gender, whether the patient is newly diagnosed to have diabetes or pre-existing diabetes and so on, right? Then this is where you enter the symptoms of the patient. So you have a long list of symptoms, you enter whatever is relevant to the patient, right? This will then go to the clinical examination parameter. Here you enter the patient's clinical data, the height, the weight, the blood pressure, so the waist circumference, right? So you enter all this data over here. Okay, and then the other clinical pictures they've asked, right? Does the patient have neuropathy, fetal edema, and so on and so forth, right? So enter all these things here. And this is the section where you enter the laboratory data, right? So patients, you enter the patient's blood sugar value, right? You enter the patient's HbA1c, you enter the patient's cholesterol values, right? I'm just adding some random data here, right? Okay, you can add the C-peptide. This is useful for cluster classification. Some of these data may or may not be, we'll make some of these data as optional, but you may consider entering all the data. The more data you enter, the more precise values you'll get, right? So every data point which you're adding has some rationale behind it, right? We are using some of these data for calculations, which I'll show you in the clinical insights page, right? So you have all this data which you enter. You click on submit. Now this is the most beautiful part of this. It'll give you the clinical insights. This is the deep insights into from what the data you entered. So here it says that the patient fits into what is known as a diabetes cluster 3 according to a paper by Anjana et al. So this is subtype classification of type 2 diabetes. So within diabetes also you're done subtype classification, and based on that you can have more precise treatment recommendation. It'll give you the obesity category also. So this patient fits into obesity class 1. Then you look at the cardiovascular insights of the patient. It will give you the 10-year CV risk, the risk category, and estimated vascular age, right? So based on the data which you entered. Renal insights, it will give you the EGFR, the category, the microalbuminuria category. Based on that, these are all required for generating the treatment plan, and they are very useful for doctors. It will give you the FIB4 liver insights, FIB4 score, and the fibrosis stage, and so on, right? Then you go on to the personalization filter. We're not still developed this, but based on both the doctors and the clinicians, the physicians' personalization, you can modify the treatment based on their preferences. Then it'll give you the treatment plan. So here's this treatment plan for the patient. So lifestyle measures, medications for the diabetes itself, and medications for comorbidities. So here it is suggesting 1200 kilocalorie low carb diet. It is suggesting details for the same, activity recommendations, and so on, right? We'll of course plan to add more this once we have the personalization filter built in. When you go to the treatment, here it will suggest what medications to give. So how many medications are required, which medication in particular, also the dosage, the side effects, everything it will give you, right? So what side effects you should watch out for. It also give you the HbA1c targets. For this patient, it is suggesting that HbA1c target should be less than 6.5%. and so on, right? So there's all these details that will go and build. And then, of course, you'll go to the medications for comorbidities. So in this case, you need a cholesterol lowering medication, statin, what type of statin, what dose, what antihypertensive to give, everything it is suggesting here. And finally, this is the main part. This is the output. So this is a suggested prescription. So it will suggest the lifestyle prescription, the medications with everything. It will give you the dose, when to take the medication, everything. It will give you the monitoring plan. How frequently should this patient be monitored? When to follow up this patient? How would you adjust the dose of the medication, and so on. And you can copy this entire thing to the clipboard. You can download this as a prescription, or you can print this out. So it's basically a clinical decision making tool for the physician. Now the physician may of course choose to make modifications on their own based on their own clinical judgment, but this is something which is going to help the doctor manage their patients in a more precise and in a evidence-based manner. Thank you.